Welcome to Introduction to Physics and Biophysics. In the past 2 weeks, we introduced the foundations of biophysics, membrane transport, diffusion, osmosis, and the physical basis of biological processes. This week, we bridge these principles directly to clinical cases and real medical technologies, demonstrating how physics supports modern healthcare. By the end of this week, you should be able to review and apply biophysical principles such as diffusion, osmosis, membrane potentials, and energy transfer to real medical interventions. You will also explain how dialysis, nerve conduction studies, and medical lasers rely on underlying physics. Furthermore, you will analyze clinical scenarios and identify the relevant physical mechanisms, and communicate how interdisciplinary concepts work together to guide diagnosis and treatment. Biophysics is often called the language underlying physiology and medical technology. While physiology describes what the body does, biophysics helps us understand how and why those processes occur from a physical standpoint. Examples in medicine highlight this foundational relationship. Dialysis relies on diffusion, osmotic gradients, and semi-permeable membranes. Nerve conduction relies on bioelectricity, ion channels, and electrical resistance. Laser therapy is built on light-tissue interactions, energy absorption, and quantum transitions. Additionally, MRI, ultrasound, ECG, and radiation therapy all hinge on physics principles. This week focuses on 3 applied case studies. Case Study 1, Dialysis. Physics of artificial kidneys. Patients with kidney failure cannot adequately remove metabolic waste or regulate fluid and electrolytes. Dialysis uses a dialyzer with thin membranes. Blood travels on one side and dialysate flows on the other. Waste moves down its concentration gradient from the blood to the dialysate. This process is classic diffusion. Dialysate is set with a specific osmolarity. Water moves from high to low water concentration, a process known as osmosis. This mechanism pulls extra fluid out of the bloodstream. Dialysis efficiency depends on membrane surface area, pressure differences, and blood dialysate flow rates. These principles are derived conceptually from Fick's law and directly from fluid mechanics. Dialysis restores pH balance, electrolyte balance, and normal blood volume regulation. Dialysis is like a highly optimized, physics-based filter that replaces kidney function using concentration and pressure gradients. Case Study 2, Nerve Conduction, Bioelectricity in Practice. Nerve conduction studies help diagnose various conditions, including neuropathies, muscle disorders, and nerve injuries. Neurons maintain a voltage difference across their membrane, typically around -70 millivolts. This potential is created by unequal ion distributions, selective ion channels, and the Na plus SOx K plus pump. When a neuron is stimulated, Na plus channels open, causing the membrane to depolarize. Subsequently, K plus channels open, leading to repolarization. This sequence generates a self-propagating electrical signal that travels along the axon. Clinicians apply a small, controlled electrical pulse to a nerve. The machine then measures conduction velocity, amplitude, and latency. Relevant physics concepts include the electrical resistance of tissue, capacitance of the cell membrane, and Ohm's law. Myelin acts like electrical insulation. This insulation reduces current leakage and significantly increases conduction velocity, enabling saltatory conduction. In conditions like multiple sclerosis, demyelination slows conduction, which is exactly what NCS is designed to detect. Nerve conduction studies directly apply concepts of electricity, circuits, and potentials. Case Study 3, Laser Therapy. Light tissue interactions. A laser produces light that is coherent, monochromatic, and highly directional, distinguishing it sharply from regular light. When atoms absorb energy, their electrons jump to higher energy states. When stimulated, these electrons fall back, releasing precise photons. These photons then stimulate more emissions, producing an amplified uniform beam. Lasers have numerous medical applications, including cutting tissue with precision, sealing blood vessels, and breaking up kidney stones. They are also used for stimulating healing in physical therapy. Laser effects depend fundamentally on how the light interacts with the body: absorption, penetration depth, thermal effects, photochemical effects, and mechanical effects. For example, retinal surgery utilizes selective absorption by pigmented tissue. Low-level laser therapy uses low power for biostimulation and improving local blood flow. Dermatology lasers target melanin or hemoglobin, with the choice depending on the specific wavelength used. Laser medicine is a perfect example of how optics, quantum physics, and physiology combine for clinical benefit. This course emphasizes integration, and this week explicitly ties earlier physics principles to real medical decisions. Understanding these connections better prepares students to communicate with interdisciplinary teams. Physics principles like diffusion and osmosis are applied in dialysis, IV fluids, and lung gas exchange. Electric potential is crucial for nerve impulses, EKG, EEG. Magnetism is fundamental to MRI imaging. Optics are used in laser therapy and ophthalmoscopy. Fluid dynamics govern blood flow and ventilators. Thermodynamics applies to fever regulation and hypothermia treatment. Nuclear physics is the basis for radiation therapy. Here are 3 questions designed to embed the concepts we discussed. Please think about the questions and submit your answers in this week's assignment session. Question 1. A dialysis machine increases dialysate flow rate. What physical principle explains the improvement in waste removal? Question 2. A patient with diabetic neuropathy shows reduced conduction velocity. Which biophysical factor is most likely affected? Question 3. A dermatologist chooses a 532 nanometer laser to treat vascular lesions. What makes this wavelength effective? Physics is not separate from medicine. It is fundamental to how the body works. Dialysis is essentially applied diffusion, osmosis, and fluid mechanics. Nerve conduction studies rely on bioelectricity and membrane physics. Laser therapy uses optics, quantum mechanics, and heat transfer. Biophysics provides a conceptual framework for understanding clinical technology and physiological processes. As we reach the end of this course, we have explored how the fundamental principles of physics provide a powerful framework for understanding the human body and the technologies used in modern healthcare. From the mechanics of movement to the flow of blood, from the behavior of light and sound to the intricacies of electricity, magnetism, and nuclear interactions, you have seen that physics is not abstract. It is deeply embedded in everyday clinical practice. You learned how motion, energy, forces, and fluids shape physiological functions such as breathing, circulation, and muscle contraction. You examined how waves, optics, and electromagnetism become essential tools in diagnostic imaging, from ultrasound to MRI. Through our biophysics modules, you connected membrane transport, diffusion, and nerve conduction to real biological processes and medical interventions. And in the final weeks, you applied these concepts to case studies, dialysis, nerve conduction tests, and laser therapy, demonstrating how physical principles guide clinical decision-making. More importantly, you have developed the ability to think like a healthcare professional who understands the science beneath the surface. This means not only identifying the relevant physics in a scenario, but also communicating effectively with interdisciplinary teams, physicians, nurses, engineers, technologists, who rely on shared conceptual language to deliver patient care. As you move forward in your studies and future clinical experiences, remember that physics is more than equations. It is a way of understanding how the world works. The concepts you mastered here will continue to appear in anatomy, physiology, pathology, and medical technology. With this foundation, you will be better prepared to interpret clinical data, understand new technologies, and make informed decisions that support patient health and safety. Thank you for your dedication and engagement throughout this course. I hope you carry this scientific perspective with you wherever your healthcare journey leads.